Rahim. The topic for today's discussion is eye movements. The eyeballs are moved within the orbit by six extraocular muscles. The six extraocular muscles have three pairs. There are two pairs of the recti muscles and there is one pair of oblique muscles. In two pairs of recti, we have superior and inferior rectus muscle forming one pair, and we have a medial and a lateral rectus muscle forming the second pair, and we have a superior oblique muscle and an inferior oblique muscle forming the third pair. So six extraocular muscles are there forming three pairs, two pairs of recti and one pair of oblique muscles. These extraocular muscles are attached to the outer surface of the eyeball, and they are responsible for causing the eye movements. And remember that these muscles are reciprocally innervated. By reciprocal innervation, we mean that if one muscle of the pair is going to contract, the other muscle of the pair will be relaxed. Again, I'm repeating, these are reciprocally innervated. By reciprocal innervation, we mean if one set of muscle is going, one muscle of the pair is going to contract, the other muscle in the pair will be relaxed. And again, I will emphasize that do not confuse these extraocular muscles with the intraocular muscles. Intraocular muscles are the muscles present within the eyeball. Those are smooth muscles, and these are the ciliary muscles and the muscles present in the iris, and extraocular muscles are present outside the eyeball, and these are skeletal muscle and these are under voluntary control. Now this is the diagram showing you the extraocular muscles. All six muscles can be seen in this diagram. So here we see the different muscles. So first, this is the superior rectus muscle. The other muscle along with this is the inferior rectus muscle. So superior and the inferior rectus muscle form one pair of recti. The other pair is the other pair is formed by the lateral rectus muscle and the medial rectus muscle. So this is the medial rectus muscle. It is present on the medial side of the eyeball. The lateral rectus muscle, it is present on the lateral side of the eyeball. Superior rectus muscle is attached on the superior part of the eyeball, and inferior rectus muscle is attached to the inferior part of the eyeball. These are the four recti muscles forming two pairs, and the third pair is formed by the oblique muscles. Here you can see this is the superior oblique muscle, and the other muscle of this pair is the inferior oblique muscle. So we have six muscles, again repeating: superior rectus muscle and inferior rectus muscle forming one pair, medial rectus muscle and lateral rectus muscle forming the second pair, and superior oblique muscle and inferior oblique muscle forming the third pair of the extraocular muscle. All these extraocular muscles are skeletal in nature, and these are innervated by somatic nerve fibers. Now, actions of these muscles, it depends upon the position of the eye at the time of muscle contraction. So, different muscles, when they contract, these produce different actions or cause the movement of eyeball in different direction. So here we see the functions or the actions of the individual muscles. So if there is contraction of the medial rectus muscle, it is going to cause the eyeball to move medially. So if there is contraction of medial rectus muscle, the eyeball move medially, and when medial rectus muscle contract, lateral rectus muscle will be relaxed, which is the basis for this is reciprocal innervation that we just discussed. And if there is contraction of the lateral rectus muscle, the eyeball will move laterally. Lateral rectus will move the eyeball laterally. This is also known as abduction. I'm repeating that lateral movement of the eyeball is known as abduction. Similarly, the medial movement of the eyeball which is produced by the contraction of medial rectus muscle, is also known as adduction. Adduction, medial movement; abduction, the lateral or the outward movement of the eyeball. When the eye is turned nasally, so when the eyeball is turned nasally means on the medial side, the contraction of the inferior oblique muscle will cause elevation of the eyeball. I'm repeating that when the eyeball is turned nasally, it is in medial position, close to the nose, then the contraction of the inferior oblique muscle will cause elevation of the eyeball, and the contraction of the superior oblique muscle will depress the eyeball in the nasal position. Again, I am repeating that in nasal position, the inferior oblique muscle cause elevation of the eyeball. Elevation means upward movement of the eyeball. And the superior oblique muscle will cause depression of the eyeball, means downward movement of the eyeball. And when the eyeball is turned laterally, that is in outward position, the elevation of the eyeball is caused by the contraction of the superior rectus muscle, and the downward movement or depression of the eyeball is caused by the contraction of the inferior rectus muscle. Now we will see all these functions on the diagram. Now look at this diagram. This shows us the extraocular muscles. All six muscles can be seen, and here we are going to repeat the actions of each muscle. So we start up with the lateral rectus muscle. When there is contraction of the lateral rectus muscle, this will cause the eyeball to move outward or laterally, and this is also known as abduction. And when there is contraction of the medial rectus muscle, this will cause the eyeball to move medially, and this movement is also known as adduction. Contraction of the superior rectus muscle will cause elevation of the eyeball when the eyeballs are directed outward, and contraction of the inferior rectus will cause depression or downward movement of the eyeball in outward position of the eyeball. And when the eyeballs are moved medially or nasally, when the eyeballs are moved medially or nasally, contraction of superior oblique muscle will cause a downward movement of the eyeball, and contraction of the inferior oblique muscle will cause upward movement of the eyeball. So this is the action of the individual muscles. The superior and the inferior oblique muscles are also involved in causing the rotatory movement of the eyeballs around antero-posterior axis. The movements that we just discussed, these are the movements of the eyeballs which are produced along the horizontal axis, and the rotatory movements of the eyeball along the anteroposterior axis are produced by the superior and the inferior oblique muscle. By the anteroposterior axis, we mean the line which joins the anterior and the posterior pole of the eyeball. So this diagram, these arrows are also showing the rotatory movements produced by the superior and the inferior oblique muscle around the anteroposterior axis. Now, physiologically, there is a different way to classify the eye movements. Okay? We just anatomically discuss the functions of the each muscle, that is the elevation, depression, lateral rotation, lateral movement, and the medial movement. But physiologically, there is a different way to classify the eye movements, and we mainly have four classes or four types of the eye movements, which include the convergence movements, optico-kinetic movements, pursuade movements, vestibular movements. These are the four types of the ocular movements physiologically, and these ocular movements are controlled by different neural systems, means different areas of the brain are responsible for controlling these movements, but all these finally have a common path, which means the motor neurons that innervate the muscles. So the extraocular muscles are innervated by the axons of the motor neurons, and these motor neurons are have a supranuclear control, means the higher areas of the brain which are sending signals to these motor neurons, and these motor neurons in turn will innervate the extraocular muscles. The detail of the neural control of the ocular movements we are going to discuss after discussing these physiological types of movements. So first we are going to talk about the convergence movement. Now, the convergence movements are the gaze shifting movements. Gaze shifting movements mean that the movement of the eyeball, which is produced when you shift your gaze from one object of interest to another object of interest in the visual field. For example, first you're looking at a far object and then you shift your gaze from a far object to the near object, and these type of movements are convergence movements. Okay, and these are part of the accommodation reflex we have already discussed in detail, and the function of these convergence movements is to maintain a single binocular vision. And in this convergence movement, both eyeballs are going to move medially. When you look forward, when you look at a distant object, your eyeballs are parallel, and they are the pupils are in central position. Okay? But when you shift your gaze to a near object, both eyeballs are going to move medially, and this medial movement of both eyeballs will be brought about by the contraction of the medial recti muscle on the both sides, and this movement is controlled by the areas in the frontal cortex which send signals to the motor neurons which are innervating these muscles, that is the extraocular muscles. Next type of movements are optico-kinetic movement. Again, optico-kinetic movements are gaze shifting movements. In this type of movements, the gaze shifts rapidly from one object to the other object, and this type of ocular movements occur when visual scene is continuously changing in front of eyes. For example, when you are reading a book, your eyes are moving from one word to the other word, and then from one line to the other line. So your visual scene is continuously changing. So your eyeballs are continuously moving from one object to the other object. This is also seen when you are riding in the car and you are looking out of the window. When you are looking out of the window, the visual scene in front of your eyes is again continuously changing, and every time when the visual scene changes, you focus on an object in the visual field, so your eyes will continuously making jumps from one object to the other object. The same phenomena is also observed when you are looking at a painting. In the painting, there are different highlights. You are at one time looking at one highlight of the painting and then at the other highlight of the painting, and your eyes will continuously move from one object to the other object of the interest. Now, when you're moving the eyes from one object of interest to the other object of interest, the eyes make jumps. These jumping movements that occur, these are known as saccades. I'm repeating that when you are shifting the gaze from one object to the other object, during this shifting, the eye is going to make up a jump, and this jumping type of movement is known as saccades or saccadic movements. During these saccading movements or during shifting of the gaze, the vision is suppressed. You will also observe, you can do it and you can observe it, that when you're shifting the gaze from one object of interest to the other object of interest, the vision is not as acute between the focuses. And these types of movements, that is the optico-kinetic movements, are controlled by the areas present in the frontal cortex. Okay, the center for the first type of movement, that is the convergence movements, was also present in the frontal cortex, And the higher areas of the brain which are involved in the control of opticokinetic movements, again the frontal cortex is involved in it. The third type of movements are smooth pursuade movements. Now, smooth pursuade movements occur when the eyes are fixed on a moving object. In the in the previous type of movements, that is the opticokinetic movement, we talked about the fact that or the condition or a situation in which the scene was continuously changing. Here, the scene is not continuously changing. You have fixed your eyes on an object, and that object is moving, and you will continue to follow that object. Now, in following that object, the movements which are produced by the eyes, which are produced in the eyes, are known as smooth pursuade movements. So, smooth pursuade movements follow the moving visual targets. For example, you are following a ball, ping pong ball, which is moving up and down, or you are following the pattern of waves on the surface of sea. So when you are following the pattern of waves on the surface of sea, your eyeballs are going to make up a rhythmical pattern of movement, and that rhythmical pattern of movement is known as smooth pursuade movements. And smooth pursuade movements are controlled by the centers present in the cerebellum. The fourth type of movements are vestibular movements. The vestibular movements are gaze stabilizing movements and are initiated by vestibular mechanisms when the head is rotating. So these are in that situation when the head is rotating, rotational movement of head is there, and this is going to initiate the gaze stabilizing movement or the vestibular movements. And these movements are controlled by the equilibrium centers present in the brain, and these movements are responsible for maintaining the visual fixation during head rotation. Now, the control of the ocular movements. First, we are going to see which nerves are innervating the extraocular muscles. In the beginning, we enumerated the muscles that we have four recti and two oblique muscles: superior rectus, inferior rectus, medial rectus, lateral rectus muscle, and superior and inferior oblique muscles. There is a very easy way to remember which nerve is innervating which muscle. This is the formula to memorize it. LR6 SO4. Now what does it mean? LR mean lateral rectus muscle. So lateral rectus muscle is innervated by sixth cranial nerve. I am repeating, LR6 lateral rectus muscle is innervated by sixth cranial nerve, which is the abducent nerve. Then is SO4. SO4 means superior oblique muscle is innervated by fourth cranial nerve. Superior oblique muscle is innervated by fourth cranial nerve, which is the trochlear nerve. So lateral rectus is by sixth cranial nerve, which is abducent nerve. Superior oblique muscle is innervated by the fourth cranial nerve, which is the trochlear nerve. And what about the rest of extraocular muscles? The rest of extraocular muscles are innervated by third cranial nerve. So we are left with superior rectus, inferior rectus, medial rectus, and inferior oblique. All these four muscles are innervated by third cranial nerve. Again, I am repeating the innervation of these recti and the oblique muscles. Lateral rectus is innervated by sixth cranial nerve, which is the abducent nerve. Superior oblique muscle is innervated by the fourth cranial nerve, which is the trochlear nerve. The rest of the muscles that are the superior rectus, inferior rectus, medial rectus, and inferior oblique muscles are innervated by third cranial nerve, which is the oculomotor nerve. Now the nuclei of these cranial nerves are present in the brain stem. Here you can see this is the brain stem. This is these are the pons, and this is the medulla, And in the brainstem, we can see the nuclei of the cranial nerves. Here is the nucleus of the oculomotor nerve, and this is the nucleus of the trochlear nerve, and this is the abducens nerve nucleus. So this is the innervation of the extraocular muscles. So when there is stimulation of, let's say the trochlear nerve, this is going to cause contraction of the superior oblique muscle. And when there is stimulation of sixth nerve, it is going to cause contraction of the lateral rectus muscle. Now we will move on to the supranuclear control of the extraocular muscles. This is the nuclear control. Nuclear controls means the lower motor neurons which innervate the extraocular muscles directly, and these are the nuclei of the third, fourth, and the sixth cranial nerves. And supranuclear controls mean the higher areas of the brain which are responsible to control these movements. So there are two important areas in the cerebral cortex which exert its influence on the movements produced by the extraocular muscles. So these are, one important area is present in the frontal cortex. This is the voluntary fixation area. This is present, again I'm repeating, in the frontal cortex, and this area controls the extraocular movements through this frontotactile tract. Frontotactile tract means the fibers coming from the frontal cortex ending up onto the pretactal nuclei present here. And the other area in the brain which controls or exert influence on the extraocular movements is involuntary fixation area, which is present in the visual association area, and that is the occipital cortex. So it forms the occipitotactile and the occipitocollicular tract. From the frontal cortex, we have the frontotactile tract terminating in the pretactum, and from the occipital cortex, which forms the involuntary fixation area, we have the occipitotactile tract ending up in the pretactum and occipitocollicular tract ending up in the superior colliculi. Now from the pretactum and from the superior colliculi, these areas or these nuclei are connected to the cranial nerve nuclei, which directly innervate the muscles. Here we can see that these are the pretactal and the superior collicular areas, and these are connected to these cranial nerve nuclei as well. This is the vestibular nuclei. Vestibular nuclei present in the brainstem, and it receives signals from the vestibular apparatus present in the ear, and this vestibular apparatus has the receptors which are stimulated when the head is rotating, and rotation of the head will cause the stimulation of vestibular apparatus, and it will send signal to the vestibular nuclei here, and from the vestibular nuclei the signal will be transferred to the nuclei of the cranial nerves, that are the abducens and the trochlear and the third cranial nerve. This is the medial longitudinal fasciculus or the medial longitudinal bundle which connects all these nuclei present in the brainstem. So that is how the cranial nerve nuclei are influenced by various centers present in the higher brain areas, as well as they receive signals from the vestibular nuclei present in the brainstem. Again the same thing, now in a slightly different way. This is the frontal eye field, frontal cortex. We just talked about it, that frontotactile pathway जो है, it sends through the frontotactile pathway. The signals from the frontal cortex are sent to the pretactum region, and from the pretactum to the cranial nerve nuclei to control the ocular movements. Similarly, from the occipital cortex through occipitotactile and occipitocollicular fibers, again the movements of the extraocular muscles are controlled. Next topic is strabismus. The strabismus is also called as squint or crossed eyes. It is also known as squint or crossed eyes. In Urdu हम इसको क्या कहते हैं, भेंगापन. जो भेंगापन जो है, that is उसके लिए जो टर्म यूज होती है medically, that is strabismus, and we can define it as lack of fusion of eyes in one or more of the visual coordinates. It is the lack of fusion of eyes in one or more of the visual coordinates. There are three types of strabismus. It can be horizontal, it can be vertical, or it can be torsional. I'm repeating, it can be horizontal, it can be vertical, or it can be torsional. Now, these different types of strabismus is based on the deviation of the eyeball. If the eyeball is deviated in horizontal plane, either inward or outward, the strabismus is known as horizontal strabismus. Eyeball is either moved inward, as is the case in this diagram. One eyeball is normal, it is for having a forward gaze, while the other eyeball is rotated medially. This is an example of horizontal strabismus. Then it can be torsional. In torsional strabismus, the eyeball will be deviated in an inclined plane, like outward, downward, here again upward and inward, or downward and outward in oblique lines. So this is called as torsional strabismus. The other type is the vertical strabismus. In vertical strabismus, the eyeball is rotated either upward or downward. So this type of strabismus is called as vertical strabismus, in which one eyeball is either deviated in upward or downward direction. I am repeating again, three type of strabismus: horizontal, torsional, and vertical. In horizontal, the eyeball is deviated either inward or outward in the horizontal plane. In torsional strabismus, the eyeballs are deviated in inclined planes, and in vertical strabismus, the eyeball is deviated either upward or downward. Now, this diagram shows you a lot of information, I should say. Here we can say different abnormalities. This is the normal eye. What can you see over here? First thing that we see is the drooping of the eyelid, which is known as ptosis. So drooping of eyelid, we can see the deviation of the eyeball. Eyeball is deviated outward and downward. There is ptosis. The eyeball is deviated downward and outward. So can you guess what can be the abnormality? This is the case of paralysis of the third cranial nerve. So if third cranial nerve is paralyzed, if there is lesion of the third cranial nerve, the muscles which are going to be affected are the superior rectus, medial rectus, and the inferior rectus and the inferior oblique muscle. So there will be unopposed action of the lateral rectus muscle and the superior oblique muscle, and this will cause the eyeball to move, to deviate outward and downward. Since we know that the function of the lateral rectus muscle is to cause the eyeball to move outward, and the function of the superior oblique muscle is to cause the eyeball to move downward. So the eyeball is rotated downward and outward. This is the case of third nerve palsy, lesion of the third cranial nerve. Here you can see the squint, the eyeball is deviated inward. Again, the patient of strabismus, this is a trochlear nerve lesion. So the eyeball is deviated upward and slightly inward due to lesion of the fourth cranial nerve, which is the trochlear nerve. So this is the end of this lecture. So in this lecture, I'm just going to sum it up. We talked about the movements of the eyes, and in the beginning, we first discussed the types of the extraocular muscle, then the actions of the individual muscles, then we discussed the physiological types of the movements, how do we classify different eye movements physiologically, and then then we discussed about the neural control of the eye movements, and finally different lesions produced by the or different features produced by the lesion of different cranial nerves which innervate the extraocular muscles. Thank you.